My name is Blythe Tyler, and I am the CEO of Care House of Oakland County. We are a child advocacy center based in Pontiac, Michigan. And just one example, I like to say a great example of what child advocacy centers look like throughout the state of Michigan. We have 40 child advocacy centers here in Michigan that cover most of the state, and Metro Detroit is definitely covered fully by those. Our mission is to make sure that we provide a safe place for children to come when there are allegations of abuse. And so our goal really here is to impact the safety of every child in Oakland County. Child advocacy centers are an amazing resource in the community that so many people don't know about unless they need to. And I want to change that.
That's very good. How will some of these families see the warning signs in their children concerning, allegations of abuse, or if the child has been abused? How can they see the warning signs from that child?
That's a good question. Signs and symptoms of abuse are varied, and after more than 40 years of doing this work and protecting children and seeing so many children be abused, we now really understand the patterns that predators use to be able to have access to kiddos. And so what we want to do in this community is to prevent those grooming behaviors that predators are able to. I don't like that. Okay, that's all right. I'll just start over. We want to provide protections for children so that predators don't have access to them. And so that can look like a lot of different things. One of the things is that children need to know and understand that not every adult is someone that they should trust. We tell children to respect adults, and they should, and that they can trust every adult. And that, unfortunately, is not the case. But more important than educating our kids is educating the adults around them and the institutions around them. We want to make sure that our institutions, our schools, our churches, our youth groups, our recreation centers, our camps are safe places for kids. And we can do that by instituting policies that protect them. Those policies can look like a lot of different things. Many child advocacy centers across the state of Michigan provide those prevention trainings and those community trainings to the adults so that they can protect kids.
So if someone were to suspect a child that might experience abuse or neglect that's not in the immediate family of that child, what should they do?
Always report it. I think that many people believe that children are, while they're susceptible to abuse, that it's not their business, that they don't want to ruin someone's life. And the reality is that if you suspect that abuse is happening to a child, it is, I truly believe, your duty to report that to the authorities. There is a number that you can call to report to the state of Michigan, and you can also go online and make a report. I would say if you're not sure what to do, you can always call your child advocacy center in your community, and they will help you walk through speak to that. If you believe that there is abuse happening to a child, you can easily go online to cacmi.org and find your local child advocacy center. That advocacy center can help walk you through the process of reporting that suspected abuse. The state of Michigan also has resources on their website for reporting abuse as well. So if you just were to Google that, report suspected abuse of a child, you'll easily find the phone number and the website to do so.
Why is it important to attend these interventions, or at least educate yourself on it?
We know that 1 in 5 children will be sexually abused before they turn 18. So I'll say that again. 1 in 5 children will be sexually abused before they turn 18. That's a lot of children. Here in Oakland County alone, that's over 60,000 children that we know will be sexually abused before they turn 18. And that is a scary number. That is an epidemic. And it's something that we don't often talk about until it happens. We know that 64% of children will never disclose that they have been abused. I cannot tell you how many times in the 10 years that I have been with Care House that adults come to me and say, I was abused. I never told anyone. Or I was abused as a child. And I told my mom or my dad or my pastor, and nobody believed me or nobody did anything about it. That is not okay. And so we must do better. And we can do better by talking about the epidemic of abuse and how to stop it. And how we stop it is to put practices in place and to talk to kids about how to keep themselves safe, and also talk to adults in the institutions that care for our kids about how to make sure that they have a safe place for a child so that predators don't have access to abuse. Because it's a long-term process typically when abuse occurs. There is a lot of behavior that happens in planning and manipulation by a predator to have and maintain access to children so we can do better. We can make sure that we cut off that access. And where kids gather, that's a great place to be able to make sure that kids understand and adults understand that there are so many ways to prevent abuse from happening. And it really is about simple practices and communication. So many people are scared to talk about it because it feels bad. Like no one wants to think about a child being abused. Certainly no one wants to think about a child being sexually abused. And yet it's happening over and over again. There is no zip code. There is no ethnicity. There is no amount of money that can protect a child from being abused. It happens everywhere. It happens in my community. It happens in your community. It may be your next door neighbor. It may be your church. It may be your school. And so to turn a blind eye to it and say, that's not happening here, is a mistake. I know that when I started here at Care House 10 years ago, I was here for maybe 3 or 4 months. And the first time that I drove into the parking lot and saw the city of Farmington's police car here for a forensic interview, I said to myself, it happens where I live. And so we need to do better. We need to not think that it's only happens in a place that is outside of our neighborhood, right? We need to know and understand that it happens everywhere. The statistic of 1 in 5 isn't isolated to Oakland County. It is the state of Michigan. It is the nation. That is a nationwide statistic. And so it's happening everywhere.
And you had said there were 40 advocacy centers serving communities across the state of Michigan, which, by the sound of it, is drastically less than the amount that should be for this epidemic that could be considered helpful. What are some of the biggest challenges facing these organizations today, and how is Care House working to address them?
Child advocacy centers rely on donations from the community, but they also have access to what is known as crime victim fund money. And that is through the federal government. It is fines and fees paid in restitution by mostly white-collar criminals. And so when our federal Department of Justice prosecutes and convicts, those fines and restitutions go into a special fund for crime victims children's advocacy centers have access to those funds, but those funds are unfortunately quickly dwindling. There's a lot of reasons for that, but the truth is that the fund has been going down year over year, and so the access to those funds, which are not taxpayer dollars, are continuing to get smaller and smaller. And so that puts a huge strain on child advocacy centers throughout the state for them to be able to continue to provide these vital services. I think one of the things that we didn't really touch on that's important is that a child advocacy center is very unique. So there's typically only one per county, or in some more rural communities, there is one child advocacy center that's covering multiple counties. And the reason for that is because of our specialized services and because of the work that we do so closely with law enforcement and prosecutors and child protective services. And so because we are unique and there are not additional organizations in the community that are doing the same work, it is even more important that we have access to funding. I think also the state of Michigan has done an excellent job at coming in and providing funding for us because that federal funding is dwindling, but we need more. The need is higher and the amount of funding available is much less. And so we're depending more and more on our community to help support us. There is a much greater need for our services than there is funding available at this time. And so there are a lot of things that we can do as just a person in your community that cares about kids, that wants to do something. You can talk to your legislators about the importance of child advocacy centers. You yourself can contact your local child advocacy center and ask for a tour, ask how you can be involved as a volunteer. We need the support of the community, of every community member, because you never know if the child in your life may need to access our services.
And what would surprise most people about the work you do here at Care House every day?
Let me think about that for a minute. I believe that there are a few things that are surprising about child advocacy centers to people who don't know what we do or how we do it. The first thing is that child advocacy centers are not a scary place. They are a safe space for children to come when abuse has occurred or allegations of abuse have occurred. We provide those services so carefully and so thoughtfully to kiddos and their families to make sure that they have what they need moving forward, so abuse doesn't have to define their life. We're also not a sad place, because I know that every child that walks through the door here at Care House is going to get what they need in order to move through this traumatic event. It is every child that does not walk through the door, that does not tell anyone that they've been abused, or that someone doesn't believe that they've been abused. So it's the kids that don't get to Care House, that don't get to a child advocacy center. That is what keeps me awake at night. That is what I think is so critical to our work. We do in the state of Michigan alone, we did nearly 20,000 forensic interviews last year. That, while that number is great, it is just a small portion of children who we know are being abused and have not gotten the help and access to the help that they needed.
And what are some of the goals and priorities you guys have here at the Care House for the future?
So one of our goals at Care House specifically is to have law enforcement and prosecutors on site. The best practice for organizations like Care House is to have that team work together. We know there are better outcomes for children, there are better outcomes for investigations, There are better outcomes for prosecution and justice and healing for children and their families when we have that multidisciplinary team that I talked about earlier on site at the Child Advocacy Center. A lot of communities may not have that kind of model and may not be able to access it. CareHouse is working on that to make sure that we provide the best possible care for kids and the best possible outcomes for children in terms of the prosecution and conviction of child predators.
It's been amazing hearing you speak about child abuse and how you guys are working so hard to, you know, remedy that and at least make the families a bit more, at ease and at least educate them about it, because this is a problem.
It is.
And for you guys to fix it and be a part of a solution in a greater scale, I'm very grateful for it. If you can leave a family in Michigan with one message today, what would that be?
If there is one message that I can give, it's that don't be afraid to talk to your children about how to keep their bodies safe. Don't be afraid to talk about their private parts correctly and anatomically correctly. Don't be afraid to ask the institutions where your kids go, your school, your church, your recreation center, your camp. Don't be afraid to ask them questions about their policies and how they keep kids safe. That is really, really important. I think also it's important to know and understand that there are many people in the state of Michigan that are mandated reporters. And a mandated reporter is a teacher, clergy, medical doctors, nurses that are mandated by law to report suspected abuse of children. And while there's a law behind that for them, everyone should take that opportunity to educate themselves on how to report suspected abuse, because if we can report it, we can stop it in its tracks.